Time-wise, is everybody ready to begin? All right, with that, we're going to go ahead and we're going to begin. This is our March 26th meeting of the Mason County Board of Health. So we're going to start with introductions. If you don't mind, we're going to go around the table and introduce everybody.
Kevin Chudy, County Commissioner.
Ian Tracy, Mason County Environmental Health Manager.
Back button.
Sunny Evans, Mason County Public Health, Environmental Health Specialist, Food Safety.
Randy Ocean, Mason County Environmental Health, Food Safety.
Miguel Gutierrez, and I'm on the Shelton City Council.
Ben Johnson, Mason County Public Health and Substance Abuse Prevention Coalition.
Darren Moody with the Hospital Commission.
And Peggy Van Busker, Hospital District 2, as opposed to 1.
Sharon Trask, County Commissioner.
Behind me?
Mackenzie Smith, Clerk of the Board.
Never done this one. How about the guy back there in the corner?
Diedrich Allen, Mason County.
Thank you. Randy Netherland, Mason County Commission, on the board. Dave, go ahead.
He's muted.
Nope, there you go.
And then you, forgot how to do that. You need retraining. Dave Wyndham, Mason County Public Health and Human Services Director.
Brooke?
Brooke Quigley, Substance Abuse Prevention Coalition.
Carrie?
Carrie Davidson, Shelton School Board.
Our mass?
Hi, my name's Rachel. I'm the Health Service Director at Squaxin Island Tribe.
How do you say your last name, Rachel?
Armis.
It is Armis, okay.
It is, yes.
Dave, you got it wrong. Art?
Yes, I'm just going to be commenting on toxic algae blooms in Mason County.
Thank you. How the hell are you on there twice? So is Ben. So we already got a couple of them that are on there. They must be recording. Okay, with that, we're going to go ahead and we're going to start our meeting. The next up is going to be our approval of the agenda. But before we do, I'd like to add, in between 5 and 6, the appointment of Rachel Armis.
I would move to approve the agenda as amended.
And I'll second that.
Okay, it's been moved and seconded for the approval of the agenda with the amendment in there of the appointment of Rachel Armis. In there between 5 and 6. Any questions, comments? Hearing none, all in favor signify by saying aye.
Aye.
Aye. Any opposed? Motion carries. Approval of the minutes.
And I have a correction to make to the minutes. On 7, Administration Report, I didn't say that there was no respiratory syncytial virus. I actually had a customer that was in the hospital at the time. I think I added that there has been respiratory syncytial virus in the area. So
Noted. Mackenzie, you've already got that, right?
I do.
Thank you. Is there any other amendments, pools, or anything? Hearing none, I will entertain a motion with that amendment.
So moved.
I'll second.
It's been moved and seconded for the approval of the minutes with that inclusion that it is not no, but that there was one. All in favor signify by saying aye.
Aye.
Any opposed? Motion carries. Next up, report from the health officer search and possible action. You want to take that, or you want me? Why don't you take it, Dave, and then I'll follow up with recommendation. How's that?
Okay, so sure. So we did put out an RFQ for the health officer position. We had one application came in, very qualified health officer who has worked with Vancouver with Alan Milnick in Vancouver Public Health. And he's been used to doing a lot of the smaller counties, so he's worked with Lewis County, other counties. We interviewed him, and went very well, and with that, I will turn that over to the commissioner.
So his full name is Dr.
Stephen Krager.
Stephen Krager. Okay, so we went ahead and we met. We had time to question. We even included our current health officer, and she was able to throw in a few questions as well. With that, she did leave before the recommendations of the board, or the ones who interviewed him. The recommendation came back as everybody was fully supportive and hoping that we would recommend for a hire. Is anybody on that committee, Carrie, or
Yeah,
any comments?
I just thought he would be a good fit, part-time. I don't know, if you met with him for a contract, or I thought that was, we were gonna
Yeah,
wait.
first we're gonna see if we'll make
Okay.
recommendations, then he'll put together a contract, and then that comes.
Anyway, I thought he was well qualified.
Carrie?
Yeah, I agree. He was well qualified. He was very well spoken and kind. I think he'd be a great fit.
Okay. Anything else you want to ask before I ask for a vote, David?
No, if this passes, then I'll start with the contractual process and we'll go from there.
So I guess it's up to the board now to see if they want to take that recommendation and move to go through the process of beginning the hiring of Dr. Stephen Krager.
I make a motion that we proceed with hiring Stephen Krager.
Second.
It has been moved and seconded that we move forward with hiring Stephen Krager. Any further comments? Hearing none, all in favor signify by saying aye.
Aye.
I
Any opposed? The motion carries. All right. Next up, Public Health Week proclamation. Get down with your bad self, Dave.
Read it again.
Are you gonna read it?
So, this year we're actually ahead of it. Who knew? So National Public Health Week happens this next month. In front of you, you have the declaration. I'm in Spokane. I don't have it sitting in front of me, but for once we are ahead of it. National Public Health Week, we are putting out pieces that'll come out daily during that week. Some video clips that our communications person is working on, and it should be a great week.
Mr. Chair, would you like a motion?
I would like a motion, yeah.
Mr. Chair, I move adoption of the Public Health Week proclamation.
And that we also recommend it to the commission?
Yeah.
Yeah, okay.
I second that.
It's been moved and seconded for the adoption of the National Public Health Week, and that it be moved as recommendation to the commission. Any further comment?
Thank goodness.
All in favor say aye.
Aye.
Any opposed? The ayes have it. In case anybody that's in the room wondering why we're laughing, we passed it this morning, so.
I think Ian should have to read it.
Yeah, I know. We made him read it to everybody
We have the podium
too.
ready for you.
He did great.
I
He
can do
did
it
great.
again.
Kind of backwards.
All right, so next up is the possible appointment of Rachel Armas. Dave, would you mind doing a quick introduction, please, for us?
Sure. I'd like to introduce Rachel Armas. We met a couple weeks ago out at the tribal clinic, just kind of a meet and greet, get to know each other, and have some discussion around public health and really healthcare overall in Mason County. And we have so many things that are in common, so many things that we can work on together. It was very exciting. We talked about emergency response. We talked about clinic work. We talked about all the things that could happen in the community. And I think the conversation went very well. We did talk about the board and the makeup of the board and how we do have a position that's set aside for the Squaxin tribe. And with that, Rachel, would you go ahead and kind of give us a little bit of your background?
So nice to meet everyone. So my name is Rachel. Most of my background outside of here actually was in the military. I spent 12 years on active duty in the Army Nurse Corps, went back to school, got my family nurse practitioner, and in October of 2023, I took over as the health director of this clinic. So that's what I'm doing.
Spectacular. Does anybody have any questions or anything for Rachel? I do know we want to start by saying thank you. We've actually been waiting for you, Rachel. We've been waiting for you for quite a while. Yep, and this is an exciting day. When I got a chance to say it to a few of the members, the smiles and the comments that came afterwards. Matter of fact, I think if you've been here, you got a lot of hugs. So with that, if you're willing to serve, I'll go ahead and ask for a nomination. Are you willing to serve?
I am.
Then I will entertain a motion for somebody to appoint Rachel Armas.
Mr. Chair, I move approval of appointment of Rachel Armas to the Health Board.
I'll second that.
It has been moved and second for the appointment of Rachel Armas onto the Health Board as a voting member. Any comments? All in...
Thank you.
Did you hear that comment? It was long-winded, but all in favor signify by saying aye.
Aye.
Aye. And any opposed? welcome. Now you're responsible for everything bad that happens. It's all your fault from now on. Just never forget that. Okay, next up, and again, truly, we are thankful that you did step up. We really are. We're not just joking about that. We've been waiting for you, honestly. With that, we're going to go ahead and move on to the health officer report. I see that Dr. Gardner is not in. Are you going to be taking that one, Dave?
Yeah, I can take that. So we've been busy with a number of things lately. Some bat reports. So Dr. Gardner's been working on that, and Ian and Audrey and I have been working on some of those things. Just a reminder that this time of year, people and bats tend to mix because bats are coming out as things warm up and the bats come out of hibernation. The same thing happens in late August, September, when the bugs start to fade away and the bats come into contact with people. We have our bat flow chart on the front of our website. So if people have encounters with bats, they can look at that, give us a call, and we'll talk them through what to do if you have a bat encounter. And other than that, COVID has taken, it's plateaued again. RSV is down. Things along those lines are calming down. We have gotten a first of the month, the CDC came out with new guidance for COVID response. DOH took about 3 weeks to get theirs together. So the CDC guidance is about a page long and DOH is 6 pages long. And we're in the process of distilling that down, and we'll get that out to folks as that comes along. Basically, we're taking our COVID response into something that more closely aligns with what we do with flu and RSV.
Wonderful. Any questions or comments?
So Dave, we've had a few people come in for COVID tests here. Do we have any kits left?
We have, I think, almost no kits left. They shut us off in January, so we have a handful left, and that's about it.
Okay.
Interesting enough, I came in to get some for some couple of different families at one time, and they all came back negative, which always made me smile. Because it used to be they were not coming back negative, remember? I used to throw them at them. No, keep waiting. Okay, excellent. Hearing no other questions, how about administration report?
Okay, so we're coming up again on another budget amendment from DOH. Have not had a chance to look at that yet. We're coming up against the end of the fiscal year for DOH, ends June 30, and then again it'll start again in July 1st. Not many changes coming to us from the legislative session. Really no impacts to our budget for local public health. Mason County Public Health should see no changes. In this coming year, we are in a better position to spend what we're getting from FPHS. This year we sent some back because we had been spending COVID dollars and other funds. We will be back to our normal funding sources, FEHS and county contributions, fee-for-service contracts, starting July 1st, which is our fiscal year over at Public Health. So no big changes. Everything looks good. Everything's funded. We did get more funding in for the opioid settlement dollars. So we have in the settlement account over $500,000 now. And some of that is one-time funding. Some of it goes on for the next 14 years. So there's money in there now to start actually to really do something that's meaningful. And we will be meeting on that. The survey has been put out, so we're working on that. In fact, I just met today with Abe and Bo. They're here in Spokane as well, so we're having some talks around those things as well.
Dave, since you brought that, I'm sorry, this is Darren Moody. Since you brought that up, I had a coffee with Bo the other day for a while to discuss what he's doing up north and bringing it down here. Do you have any idea how much of those opioid dollars are going to be available annually?
Well, annually, all I know for sure is going to be for sure is 100,000, just a little over 100,000. Some of those funds that came from the pharmacies, I think, are one-time payments from the pharmacies. So, one of those was, for example, was Walmart at $200,000 and Rite Aid and several others. So, what we can count on is about $100,000 a year.
Thank you.
And Darren, just so you know, that also includes the city has signed an ILA with us to move their money into our pot. So that's combined settlement money.
Yeah, and just to give everybody an update, Bo and I talked about a variety of things, but one of the things was forefront was their paramedic program that they've got going up there, and whether we can move that down here with District 4. And they came and presented about 2 months ago to the hospital, 2 or 3 months ago, that they could do this. So we had a good conversation about it.
Very successful up there, very successful, and everything they're touching is turning to gold.
I have to say, I was skeptical when they came and presented, saying we could do this in 3 to 4 weeks and have it running. And I asked Bo, I said, where are you getting 3 to 4 weeks? And he said, because of all the mistakes we made up here, we won't make again.
Yeah, no, they've done exceptionally. Hopefully he's talked to you about services up there as well.
We had a long conversation.
Okay, good. What else you got, Dave?
They presented down here just this morning, Bo and his team, and they knocked it out of the park. The meeting room was packed. And I've had a lot of people come afterwards. How do we get a hold of those guys? How do we bring that to our county? So they did a great job.
I'm gonna take a moment to thank our commissioners, because that was the seed money through ARPA and stuff.
American Rescue Plan,
Yep.
for sure.
Yeah. Also hospital district too.
Yep, that's true, yeah. What else you got, Dave?
So WIC is up and running. We're having clinics up there, and it seems to be going well. We've got, I've had a lot of feedback from the public about they're so tickled to have WIC in our community, and they don't have to go to Olympia to get service. They're very, very happy. I actually got hugged in a gas station the other day when somebody found out that we brought WIC back to the county. So it's very, very much appreciated. I think it's a great service. It provides just absolutely the things we're trying to do around chronic disease. Well, WIC is a great first start in that work. So we're working on a number of things right now, and as soon as we kind of figure some things through, we're going to be coming back to the board probably at our next board meeting and seeking some direction on things around family planning, some other sorts of activities. Once I can kind of get everything wrapped up and put a bow on it, and then I'll bring it to the commission or to the Board of Health.
Any questions for Dave? All right, anything else for us, Dave?
I think that'll do it.
Okay, thank you. Next up, item number 8, environmental health report.
I apologize ahead of time. I have way too much stuff that got on this agenda.
Yes.
And it just kept accumulating. And it was like last minute, oh, we gotta do this thing too. So first up is 2 on-site advisory committee applications. One of them is James Metcalf. He's an existing on-site advisory committee member, and he's applied to extend his appointment for an additional 3 years.
How many positions do we have open?
I think it was 3 positions when I last checked, 2 citizens and a designer. And actually it's 4 because the shellfish industry still has not appointed somebody.
And one of them is Mr. Whitson as well.
Mr. Whitson has applied for one of those open citizen positions. I've also recently spoke with someone who is interested in a citizen position who is an installer for his day job. I haven't received an application for him yet, but I've been engaging with him this past week.
Are you looking for us to appoint or recommendations, or what do you?
For James Metcalf, we're looking for an extension of his term if everyone's acceptable.
I so move.
Okay.
Okay, so moving seconded for James Metcalf to be extended for another 3 years. Any comments? Hearing none, all in favor signify by saying aye. Aye. Any opposed? The motion carries.
Next is Art Whitson. He's not here today to speak for this specific item, but Art Whitson is on our Art Whitson is on our Clean Water District Advisory Committee currently, and he's applied to also be on the On-Site Sewage Advisory Committee. I don't know if you want to schedule an interview or.
Actually, we've the county commission's already interviewed him and found him to be a good candidate for the other. I don't see a need for us to interview. Do we want to just go for an appointment through here, or do we still need to appoint it through the county commission?
It would be here for this one.
Okay.
So I so move.
Okay.
I second.
There's a motion on the floor. It's moved and seconded for the appointment of Art Whitson to this position. Any discussions, comments? All in favor signify by saying aye.
Aye.
Any opposed? Thank you, Art. It's your turn. You're gonna carry the water now. Thank you.
Congratulations.
Okay, so The next item is a big item. I don't necessarily need an action today. This is just introducing the policy. So this policy stems from area-wide issues with people living in what we call non-permitted living conditions. So sheds, RVs, tents, anything that's not a house, basically. And all the problems that come with that. A lot of it is around sewage, a lot of it has to do with planning regulations. Kel's here today to also speak about this. The planning regulation, I think you can correct me if I'm wrong, Kel, basically says you can have an RV occupied on your property part-time, one RV, and there are many people that are living in one RV full-time, and then beyond that, living in multiple RVs full-time. And years ago, our approach was, okay, well, this is in violation of our code, we're just gonna enforce it. And we tried that, and we didn't end up getting the health and sanitation other code violations corrected. It just moved it to different properties and chased them around. And we still have some of that happening now with properties where they're squatting on somebody's property and they're moving to other properties that someone's not keeping an eye on. So we still have some of that going on, but with our using enforcement discretion for our regulations for these situations, the past few years has been very successful in getting people set up to get those basic sanitation needs met. And then when we're able to have those needs met, planning has agreed to not tell people they can't stay in their RVs on those properties. So that policy is how we've been operating, but it's a big issue, and I feel like the Board of Health, as the body that sets policy for our department, should weigh in on it or be aware of it, so that if this is not something that the board is okay with, we can make changes to our policy. But that's what environmental health has been doing, and planning as well with our code enforcement. And I guess it's a big document. I don't know if all of you had time to read it in depth or have any questions about it.
I haven't read it all. I'm gonna take some time to go through it, and the way I feel is it has to go through the commission and everything else too, because this will be a change in our codes. Is there anybody?
Well, this is not a code change. This is just environmental health policy. I mean, there's some involvement with DCD's regulation and them using enforcement discretion. But
if it's effective, I'm gonna wanna.
So is it an enforcement change?
It's
not a policy change.
This is a change to the discretion with which we enforce the code. So we're not changing code here. This is our policy. In any regulation, there's some amount of enforcement discretion where the department can decide to prosecute something or not, so to speak. Same as criminal cases go. There's some things they're violations of the law, but they don't have the resources to pursue those. It's the same situation with this.
Well, for years we've been hearing that, but at the same time, if there's something that should be being done, then when we have policy, we expect it to be done, but at the same time, maybe we should change it. And if you're working with planning, I would hope that we would look at ways that would be effective. And if it's not effective, then.
Well, I mean, I think there's a much larger issue than just Mason County that we don't have any control over, economics. And our departments have seen an exacerbation of what we used to be able to successfully pursue enforcement on people illegally living in an RV full-time in multiple RVs. It's just beyond, it's grown beyond our capabilities and resources, and like Ian says, you would otherwise just be chasing people around. And so we just are setting the policy of, in planning, we choose not to enforce on people living full-time in an RV unless there are sanitary and health, real health hazards. And we try to do, so it's like triaging.
But perhaps we should look at, if we're not gonna do it, then we should be changing the rules, is what I'm saying, to allow for things or whatever.
Well, we don't fully, there's some things that the state, like say L&I, we wouldn't have the authority under state law to allow someone to live full-time in an RV. So we just we basically say we don't enforce on that. Someone living, you know, full-time in an RV and that's in clean sanitation environment, but we can't say, oh, you're legally okay to live in an RV full-time because that's in violation of L&I rules.
Well, I'm sure you can imagine, we get phone calls on those things, and the first thing they do is read us the law and say, why aren't you enforcing it? I get that all the time, I'm sure.
So if I can add something to that, Chairman.
Please.
I think we need to, I hate to split hairs, but agree on what is code, policy, and practice. Because it sounds like we're talking about the three interchangeable here, not changing any of the code for the county.
Correct.
And policy to me is what's written. Practice is what we do with the policy. So it sounds like the practice has been that we just kind of triage the best we can, but there is a policy in place, so.
There is no policy in place.
No written policy.
Not specific to these types of situations.
There's the code which says that you will. That's the problem. So if it's not something we can do, we should have more, just my opinion as one person, we should have more conversations on that. Because we teach people not to follow the law when we let them just not follow the law over and over and over and over and over and over again. After a while, they think everything's that way. So maybe we should have that conversation broke down here sometime.
The biggest issue is the code, as Kel said, sure, there's L&I requirements on her side. On my side, it's the State Department of Health sewage requirements. The State Department of Health sewage requirements are every place where people live or congregate is served by a septic system or public sewer. That's it. There is no allowance for anything else.
Nothing allowed for temporary, huh?
No. So there is no middle ground, which is where these situations fall in feasibility, where we are able to get them to meet minimum sanitation requirements, but they're unable to meet the state code.
And we do know this county for the longest time was a big majority of them were temporary. That's just how this county was built. So maybe we have further, any comments or questions from anybody else? Okay, so right now you don't want nothing from us, just
This is just, if anyone has any direct feedback on the policy now, I can take that and then, implement that. But if you can think about it, and we can bring it up at another meeting to discuss. Eventually, I would like to have a signed policy from the board so that, that our staff have clear direction on the legitimacy of practice, as you've said.
And that's what I'm trying to get at, is speeding is the law, your policy says you'll pull people over, your practice is what you do once you pull them over, and the leeway that you're allowed there. But the other part of that may help in the future is, I always say, go look at what everybody else is doing.
Yeah, and this policy
let's look at the surrounding
mirrors
counties
other
and see what the other counties are doing surrounding us and go, okay, is there something in there that we can meld into our practice or policy? Then we don't have to write it twice.
Well, that's exactly what I've done here.
That's good logic.
This was originally a policy from Jefferson County. They were already doing the exact same thing we were doing. So I modified it to fit our specific situation.
So we'll go ahead and look at it some more and maybe bring back for the
Yeah,
next.
I need to read through it again.
Bring it back for the next meeting.
Yeah, it's, like I said, I
Yes.
apologize ahead of time, it's a lot for this meeting.
And also maybe brief the commission in between also. What else you got for us?
Next is street vending, and I brought Sunny and Randy here with me today, if you have any detailed questions. So basically, we have two types of food service facilities in Mason County. There's a brick and mortar establishment, and then there's really three, sorry. There's two fixed facilities, or hard infrastructure facilities, which are mobile units like food trucks, and then brick and mortar facilities, restaurants, McDonald's, all those types of places. We have the third category are temporary events like fairs, Oyster Fest, things like that. We've had a request to allow in Mason County a variance from the food code, which some other counties are doing, particularly Thurston County right now. They're in their second year of piloting a program for what they call street vending. And street vending is basically a temporary event that's not associated with an event. So someone could set up a tent with all the stuff they would have at a temporary event on some corner where they're permitted to be by the property owner, and they could serve food. And there's extra requirements for them, there's limitations on menu, but we've had several people in the county that have requested we allow this. And just want to bring it to the board to see what your thoughts are.
Is that what the lumpia people do?
Yeah. Not anymore.
Okay.
Not anymore.
So, before we even start, I want to let everybody know my son has a food trailer, of which we do it, and we're really blessed, because not only do I see these two there, I see them at Nita's and Burger Claim, because I have those places there. We have a staff that is not, they can be heavy. I witnessed it a few times. The nicest one over here was really heavy, but at the same time, when it was done, it had to be done, it had to be said. And what happened is you ended up with people that were educating, what's that old expression, give a man a fish and he'll eat for a day, teach him how to. When it was done, she had taken the time, and so they take the time to train them. They've trained my son, they tell him not just what he needs, not just get on him, express all the way through how it's supposed to be done in order to protect everybody. You even see them do it with somebody who's been in business with George and all that. I, for one, sitting back, and because I don't get involved with it, I just appreciate it, because literally, that's how you protect everybody and you don't hurt the business. You just teach them how.
Let's be truthful, sons aren't listening to dads, they're gonna listen to somebody
I
else.
agree with that. I'll agree with that too. Because literally, when I see them, I just turn around and walk away at our place. But literally, it's fun to watch them, and especially my son afterwards tell me, "Nope, I learned I have to do this. I have to do this. I take care of this." But I watched it at Nita's here recently, and you were there for quite a while. But by the time it was done, of course, they all think, the county person, but they knew what to do. I watched them be taught how to do all of it, so when they walk out, it's expected that you do what you were taught. And so a compliment to you on that, because it was nice to see.
So if I'm understanding it, you're basically saying I can put up a tent at my house and sell food out of it?
No.
Yeah, is that what they're asking though?
So what they're asking is, let me know, Ian, if you're ready for me to talk or not.
You can go ahead.
Okay. So what this is it's like a combination here between a mobile and a temporary. So what they're wanting to do, there's code language for this. There's just not a permit for this. So a mobile is in a cart or a truck that is readily movable just like that. A temporary is what you see, Oyster Fest, Forest Festival, things like that, has to be with an event. Catering, temporaries, things like that. This is basically a combination of those. It's gonna be a temporary setup, but they are not gonna be able to move like a mobile truck or a mobile cart. They also don't have the same parameters when it comes to like their water source and their hand washing. So that's where that variance comes in. We have all these codes, I think you guys all got a copy of this, that it's going to be a variance from those things. And that variance is gonna take them from the mobile requirement to the temporary requirement. So it's a combination of the two.
They still have to follow all of the food handling guidelines?
Yes, absolutely. They have to follow all of the food guidelines. It will put them to where it is an annual permit for them, and we will be inspecting them regularly.
How long can they keep these things?
So that's why we're here. So Rang and I are literally Switzerland in this situation. We have no, sorry, this is my Rang. Yeah, this is my Rang, yeah. We have no sway one way or the other on this, because ultimately we literally look at all the pros and cons, and we definitely need some more suggestion on this, on where we wanna go. And I think that looking at the full thing, there are, on the pros and cons list, there's that the industry should definitely have a comment on this, because this is bypassing some of the requirements that they are required to have. If they get a mobile, they're required, if it's enclosed and you're boarding it, they're required to go through L&I and get an L&I permit approval. It's a process, okay? If they are not going to do that, then they just be able to set up, then there's a large financial deficit that they do not have to get into versus like a mobile. The other part about it is that you have these, they can literally set up anywhere with following regulation from city code and things like that. So there's all of those, but then there's the other portion of it that we look at. So look on the pro side, We have just examples of people that have called in and asked about this. The Lumpia people, they are one of those people, because they wanna set up at the hardware store, they wanna set up at this place, but there's no event going on, so it does not go into our code. They can do farmers markets, things like that, and that's what they're currently doing now. but
Is
they
that what
wanna
the
amp that up.
21 day thing was? It had to be in a,
Yes,
I didn't know that.
a
so-
multi 21 day, that means they're allowed to do 21 events within our county, but they have to be with an event. Or they can get a farmer's
That makes
market,
sense.
and then they do like the farmer's markets that's used to be Shelton, Belfair, Matlock.
Well, it's good you brought up the city, because I don't want to speak on behalf of the city, 'cause
Right.
my time there is done, but.
Right, no,
but-
trust me, it's a
but
conversation.
If you put a code in effect in the county,
Mhm.
and I go, I'm following the county code, and I walk into the city, which is in contradictory what the city is doing.
Yes,
Now
It
we're
is-
really gonna have a
It
conflict.
is literally one of the last lines that we say to anybody opening a business, is that you need to speak with your city officials before we can approve, and I have to see an occupancy, or I have to see an allotment of you're allowed to do these things. So, that is all in there, and they have to take that into consideration, so if we do this, city is something that we're gonna be going to and saying, where do you guys stand on this, because we can put into our stuff, you're not allowed to be within city limits to do this. And that comes to like some of the examples is we have somebody that said, hey, can I do a pop-up, and we call them pop-ups, they're street vending, up at the Cushman Golf Course. They don't have a lot of food, industry, brick and mortars or mobiles up there, they have a coffee stand at the moment. They have a little hot dog thing, a little vendor inside, but it doesn't run year round. So up there, they're wanting to do a pop-up to provide food and stuff like that. Is that something that we feel they could do, and they could do food safety wise? Great, probably. I mean, we let oysters be sold at Oyster Fest, and when we talk to other people that do our job, it completely boggles their mind that we have Oyster Fest with that much seafood going on. If we can do that, I know that we can do that somewhere else. But there's a lot of rules and stuff, and that's where that comes in. Thurston County has a pilot program going, and just like Darren said earlier, you know, if it's already written, you know, let's not rebuild it, let's go and make it our own. And so that's what we've done, is we've looked at a lot of different steps, policy requirements that they have in place for this program that we know that we could adopt. But, like I said, there's a lot of community and a lot of industry comment that needs to be heard on this, as well as your guys' to make an educated decision. And Randy and I are.
Dealing with people that do the signatures, collect signatures in front of stores and things like that. They've gone through so much legislation over the last 10 years of you can, with the permission of, and I could just see Evergreen Square. Somebody walking into Evergreen Square and getting permission from one of the merchants at Evergreen Square. Not the owner of Evergreen Square or the city, you know, and that's where you just convoluted.
Yes, there's a lot
Good
of
luck.
things in this that make our brains go, oh boy. And then there's the other side that, you know, like when it gets out to those rural areas that they could benefit, we think that they could do it well. But a lot of trust comes in the operator as well. And there's a lot of, I mean, we already have a lot of requirements that they're gonna have to go through.
But it's also you wanna know where they're at. You can't inspect them if you don't know where they're at.
No, there's requirements so that we,
So
just
they
like the
just
mobile,
pop
they
up like
have to.
the Olympia
Yeah,
one.
that's where the mobile requirement comes
Yeah.
in, is we have to know the locations that they're gonna be setting up
can
at, we
inspect
have to know they're required to use a commissary. There's all of those requirements that come into play, so they're not getting a variance to go away from a code, they're getting a variance to go from a mobile code to a temporary code in combination. It's like we're combining those two permits, so that's where that kind of comes in, but there's a lot of food safety requirements that have to go into place, so there's just a lot of feedback that we need on this.
Thank you.
Yeah, the biggest benefit here to someone setting up a food business is there's less overhead that they're gonna have to pay. But there is gonna be a higher license fee, and there's gonna be more scrutiny on them and more requirements that they have to uphold. It's gonna be harder for them in operation when it comes to that. There's gonna be limitations on the number of hours they can operate in order for them to do it right. So it's not like a free for all, but there are a lot of things to consider, like people that have already invested in a brick and mortar facility, and they're like, well, like you said, I can just set this up in my yard. Potentially,
what's
that
to
could
stop
be.
them from setting up Lumpia in front of El Serape over here in El Serape going,
The
really?
funny thing is, there are places where you see that, you literally see it, even, I don't know if they actually have it in the code, but you'll see them in Kitsap County. they definitely have places where they just kind of pop up and,
I don't wanna talk about Kitsap County.
okay.
Yeah, no, you're right.
But it makes
Kitsap
it,
County has a lot of
but it makes you nervous.
issues that the state does not like, specifically around that issue. They're like, what are you guys doing? We're like, yeah, it's
Nothing.
fine.
Yeah, they're doing nothing, so.
Um,
I'd
Yes.
rather,
But-
I would rather know that the people are safe in Mason County, I really would, even though I'm in it. So I would rather them be safe and nobody gets sick than us just say, you know, go ahead. It's not a big deal, because it is a big deal.
Yeah.
Like Ian was saying, there's gonna be a lot of restrictions to them. I mean, the restrictions to their menu is literally going to be 1 or 2 main items and 1 or 2 side dishes. They're not gonna be able to have a full menu. The other aspect to that is letting them only operate for a time period, like he said. And when we go in and we do an inspection, if we find violations, they don't have the resources to correct those violations on site. If they have a cold holding problem
Yeah.
and they can't get to the bottom of it because it's like their ice chest or their refrigerator that they're plugged into, that is not something we can say, move everything from here and go put it in the walk-in. It is, no, you're closed for the day. So that is also a financial burden on that. So there's just a lot of things that are gonna come into play.
Good luck, commissioners, dealing with this one.
No, but actually, but again, I think it's a good thing. People don't know, we're not supposed to, at that food trailer, we don't keep stuff overnight. It needs to be thrown away.
Right.
It needs to be. It wasn't just that we were told it. I'm telling you, it needs to be.
Well, but like
you
he
don't
was
have
talking about
space.
earlier with the policies and practices, who gets to enforce this?
Them.
yeah.
They stand their ground pretty good though. They
We
do.
do really well.
Yeah.
But at the same time, like Thurston County, and this is the other aspect that we looked at, like Thurston County, when they did this is the second year of their pilot, they only did a certain amount to try that. So we would run it like a pilot program to start with, and we were thinking, you know, we've had about 5 or 6 people that have been interested in doing this consistently. And we feel that if for some reason everybody was on board and this wanted to go through, community and industry supported it and it did go through, that we would start with that, knowing that these specific operators, we would be able to trust they would give it their best foot forward to do all of the food safety practices that we need to see if this is going to work. Because that's the only way you can actually run a true pilot program. If we get somebody that's not going to take it seriously and just, you know, is trying to make an extra dollar without following, you know, going and doing L&I stuff, things that we don't want that. So we would be very selective.
So we have our homework board to do a little studying.
Yeah.
So
Thank you, guys. Go ahead.
Yeah, the thing that we're asking for from the board today is this something that we should continue to research and look into? Should we do public outreach to see what the public thinks about this idea? Or is this just a flat out no-go from the board's perspective?
I can just give my personal opinion on it. Somebody that, I'd rather have some safety mechanisms. The idea that that it just pops up is not good. It's dangerous for everybody. We did that with marijuana when we first started. We ended up with 9 marijuana places in Belfair until we got rid of the moratorium and actually created a structure, then we were down to 3. When we had a moratorium, we did nothing. It went through the roof. So there's benefits to putting the restrictions on. So I'm open to it personally. How about the rest of the board?
I think it needs more research though, yeah.
Well, no, that's what we're
Yeah.
asking is
Yeah,
this
go-
something to keep pursuing, getting public information about the public's interest, about industry interest?
Whether or not, yeah, I think that's a good idea.
Do you guys have a timeline or
There's,
an idea?
there's no requirements or anything like that. This is
So
this is
you
something
don't
that's,
have an idea of when you want it to be in place, or if we decide to move forward, do you have a time, do you have a date that you want it to
Now,
be?
the reason why we've been getting, since I came on board with food safety, we've been getting, you know, questions and things like that. The other thing is that we've been finding people doing this without
Yeah.
a permit. And so that's where like, hey, you know, this isn't allowed.
So
Right.
That's brought up that.
how are you planning on reaching out to public to get?
I'm not sure you need to reach out to the public. It's a health aspect. What's healthy is what I would ask from this board.
Well, maybe contact the half dozen people that you've got that are interested and say, here's the fees, here's the process,
Yeah.
here's how it works. Would you have the resources to do this if we chose to go that route? Some of
we
them may
we don't
go,
know that information yet though, that's the
I
problem.
think that's the thing. I think you have to.
We're building.
Yeah, I think you have to come up with a kind of a draft program. And then it'd be great to have us talk about that again.
Mhm.
And then
if
I
you took
think,
something like Thurston's doing and go,
Yeah.
okay, this is the extra fees and the cost
Yeah.
some of these people may go, that's prohibitive. I can't afford to pay, this much. And
Yeah, I would be surprised if it's prohibitive, just because they already want to do this, and right now they're faced with buying a truck or buying a building. Some of these food trucks are $100,000, so.
Like I said, the 5 or 6 that I have, they're repeat people calling and asking about
Yeah.
this. And we've had 3 of them call just in the last month. Have you pushed this forward to your board yet? And because we tried to explain, like, we're writing things up, we're getting some stuff together, we're going to push it forward and present this to you guys. So that's kind of where we're at. Have I looked and have I kind of formatted things from Thurston County already? Yeah, I wanted to do that to see if Randy and I would be able to keep up with the demand of it as well. And so I do have some of those things and stuff like that. So right now, I do believe that we need community and industry both comment back from this. I do believe it's a food safety thing, but ultimately, this is the hard part for us because we allow temporary events and they're done safely. We do a lot of education for those events, especially Oyster Fest, but so can it be done? Yes, and that's one of our pushbacks from these people is you guys do this all the time.
Yeah.
Why can't we do this? And so that's where we're kind of, at this, Randy and I are at this equal level of, we need somebody else to make the decision for us.
I think the challenge with comparing it to an Oyster Fest though is like, that's a concentrated one weekend fixed location event.
And you've got state folks out there at Oyster Fest, between liquor and cannabis and everybody else walking through Oyster Fest inspecting in addition to what you're doing with it.
Yeah, and I just think that with this, there's so many other variables that, it's not as easy as saying, well, you do this event and so it should be, equal to the, I just think that's a really difficult, comparison to make. I think it's worth looking at.
It's very, very hard to make that comparison. Unfortunately, people that don't understand the level of a mobile or the level of a brick and mortar, that's what they compare it to. And so you can see there's like, we're on the fence on this one. We're not really sure where to go.
I think the brick and mortar people were opposed to food trucks when they first started coming.
They absolutely
were. You're gonna get that group that goes, I sacrificed and I went out and got myself the food truck or whatever else. And now you're telling me this guy can put up a tent over here next to his temporary RV?
My biggest concern, of course, is health. I'll tell you, I've eaten at that lumpia place many times, but because of who I am and stuff, I would never ask them, are you licensed or what? People probably should, but you can kind of see how I couldn't. But I've eaten there, but I'd sure like to know it's safe if I do eat there. Yeah, I actually hoped and assumed that it was, because it was so open, they even put signs in the road. So, in the road, there's a turn lane here.
I didn't really like that in the road business.
But, again, I try not, it's not my barbecue, so I try not to, literally, it's not my barbecue, so.
But you can see where this conversation has to go, because there's a lot riding on it, and it's on the fence, so that's where.
Well, I think big difference too is Oyster Fest, these nonprofits already have, like, they've got their refrigeration units and things like that, or they borrow them from other places, so.
It's a very well-oiled machine.
Right, and so if you have a temporary tent.
Yeah,
It's
and
not gonna
I
handle
wasn't
everything.
comparing that, this is what the people that are wanting to do
Right.
this are comparing it to, and we're
Right.
trying to tell them it's definitely a whole different ballgame.
But you also basically inspect them, even if it's a quick inspection before they do anything at those events.
Oyster Fest?
Yeah, it's not like they
Oh,
have
we're
a
there
free.
an educational day with
Yeah,
them.
that's what I
We're
say, it's
there
not like
all
it's a
day on
free
Saturday,
reign.
and we do inspections, and then, every single one of them has our number to call us, and, there's a lot that goes into that.
I remember as Habitat waiting for you guys, and the Masons as well, they can't.
We do a round
Yeah.
of quick contact, and then, but anyway, so that's where we're at with this.
Do you need anything else from us on that right now, or just, informational, and we'll look at it and we'll come back together again?
I guess, is there something that you're gonna need from us? Or do you just wanna bring this up at a future meeting to rediscuss?
Can you share what you have drafted up?
It's
Or did you
already been shared to you,
Okay.
that you all have in the
Okay.
packet.
And again, my main concern is gonna be safety. I have a feeling that's gonna be all of our real main concern. Costs are always important.
We don't care if people get sick.
But at the Board of the Health, again, figures
I do
safety
have
and
a
health is gonna be the main concern. Commissioners would be more economic. Okay, What else you got for us, Ian?
The next item is our shellfish closure response plans. So last September, we had closure in Lilywop and a closure in Tahuya. So there were downgrades of commercial shellfish growing areas. Thankfully, we have our clean water district now, and that reduces the burden on the county when these closures happen. So these are the kind of the administrative cleanup that happens when we get those closures. We're required by the RCW to come up with a response plan within, I think, 160 days or 180, I think it's 180 days. So we met that deadline and we submitted that on March 12th, which was our RCW required deadline. The plans were developed in coordination with DOH, so they're exactly what DOH wants to see. They were easier than previous closure response plans we've had to do because we already have a program that's in place and actively doing water quality work, and working in those areas and working on getting those upgraded. So they didn't have to be as detailed when it comes to a task matrix and things like that. Did anyone have any questions on the closure response plans?
Nope.
Based on the water quality data, we expect, if things keep going the way they're going, you never know what's gonna happen in the future, but if things keep going the way they're going, we do expect those areas to be upgraded probably pretty soon in the future. The main issue that happened is they sampled on the heat dome event that was in, I don't know how many years ago now. Unfortunately, they sampled on the heat dome event. I don't know why they did that and didn't just say, we're not gonna sample today. It's not a good representative environmental condition.
So are you on your fifth? Was it 5 to clear?
It's not how it works, unfortunately. They sample I think it's 6 times a year, and they look at the last 30 samples. So that data for that set, a high hit has to fall off of that for them to then, get you their estimated 90th down. So a lot of times areas will be downgraded, and the problem that occurred was 2 years ago. But it's getting downgraded then just because good water quality data fell off of.
That's true. Sometimes the good stuff falls off
Yeah,
too.
so it's not. I have a lot of personal issues with the system and how it's designed and structured, but that's FDA. We've got no control over that. Any questions?
What do you got for us on the abatement?
Abatement fund, this is an item that we're bringing back. When we last met, I had let the board know that basically our prosecuting attorney was not in favor of us taking out the requirement that abatements would be liened as property tax, which would then result in foreclosures. And you had said, so, bring it back up after you guys could think about it and discuss it
Be
again.
put on as a lien, so when it does sell it, it sticks with the property.
We would prefer to put it as a lien that would be collected at sale, not due to, not put on taxes.
Anybody have any heartburn with that, or are we shaking our heads to send them forward to start looking to put something like that together?
Sure.
I think so.
Okay.
That's what it looks like.
So that would be a recommendation to the Board of Commissioners for a code change to be able to allow abatements to happen without that. Okay. And we have, on the funding side of it, unless something's changed, Dave can correct me if I'm wrong, but the State Department of Health informed us that we can take the Foundation of Public Health Services money, if we have unspent funds like at the end of this period that we're coming up to, we can take that money and start an abatement fund and put that into that fund, and then it doesn't get taken back by the state.
Oh, that's great.
So that's a good way to.
We want to keep it.
Yeah, yeah.
One thing about it, by putting the lien on it that way, you may not, once the money's invested, you may not get it back as quick. If it's on the taxes, and that's why we'd get it back as quicker to be able to use it again, but if that's not how it's done, that's not how it's done. Go ahead, Dave.
No, I just agree with Ian.
Okay. Show us your face just to say you agree with Ian. Okay, Ian, are you taking this next one? Community health report, or is that Dave?
Ben.
Yeah.
Maybe it's
Or Ben.
Oh, for the community health report, it says Ian on here.
Oh, not on mine.
Melissa.
Okay,
Melissa.
oh, Melissa, I mean,
Melissa.
sorry.
Oh, okay.
I had Ben,
You just so
I
used
had
to
Ben for the
use
substance,
different for-
I had Ben for the substance use thing. Are you taking the whole,
Yeah, I think so, because, well, I don't have any other report for Melissa, so
okay,
this is it.
go for it.
So I'm supposed to share this. And there we go. So you might be looking over your shoulder a little bit. Ah, there we go. So, first of all, Ben Johnson, Mason County Public Health, Coalition Coordinator, and I'd like to introduce, and I think you probably all know Brooke Quigley from North Mason. She's one of our coalition members. And Dilma is also on Zoom today. And we, as a coalition, there's probably the first set of us went on a field trip to some of our cannabis retail stores. The first one was back in November, where we started up in Belfair. Went to a couple up there, and then we went to a couple down here. There was only one store that didn't welcome us with open arms in Shelton. But I really believe that they really didn't understand what was going on. And we just got off to on the wrong foot that day. So we're going to talk a little bit about what happened on that field trip and what our plan is to partner with our retail stores through our coalition in Mason County Public Health. A little bit of history. We started this coalition, and Mr. Moody was part of the very first coalition 10 years ago or so, I think.
About 8, 9?
Yeah, somewhere around. Yeah, somewhere around there. You were one of those that were a part of that. And then Brooke Quigley came around when we were first Shelton Coalition. We expanded to Shelton and North Mason. And then eventually, after about 4 years, we became the Mason County, included all schools, all of the county. So I'm just going to go through here. It's really small, sorry. But our mission basically is to reduce or stop use for all of our youth. That's the goal. Some of the data we use is a survey called the Healthy Youth Survey that literally just came out last week. And the numbers are actually looking really good right now, better than they have in the past years. Even before, the last one before COVID was 2018. Then there was one 3 years ago. There was typically done every 2 years, but COVID kind of threw things off. We thought that students would be using more during COVID. They weren't. They were using a lot less. The theory is that they were really isolated, not out partying, not out drinking. And then coming out of COVID, we thought that it would increase again, and that didn't happen. And we're kind of confused about that. Some of the theories are they kind of forgot how to party. The younger kids are coming into high school and they just haven't gotten out that much. We haven't been hearing about the gravel pit parties, those types of things going on. Doesn't mean they're not going to come back, but we just haven't been hearing about it. So, a little bit of our mission. We have 12 sectors represented on our coalition. Law enforcement, school district, counselors, you see the sectors there. Again, a little small for the screen. But we have 12 sectors represented. Parents, teachers, nurses, so medical, mental health. All the sectors don't come to every meeting, but we usually have regular, good, strong meetings, and our coalition members are engaged. And we meet monthly, and third Wednesday of the month at 3 o'clock. So we took off and went through the first 2 stores. And Brooke and Dilma, if you want to interject on your end, you're totally welcome. We wanted to engage with them. We wanted to see what they had to offer. Some of us had never been. I've been in some, but some of the coalition members had never been in a cannabis store. Just every one of them was well organized. The bud tenders knew their stuff. They were happy to
I just had to say it out loud.
They were happy to to work with us and educate us. We came in just to get some education from them. And like I said, they were all really open with us. They talked about how they promote or they don't promote. Most of them don't spend a lot of money on promotion, although in Belfair, there is a giant billboard, and that store pays $2,900 a month for that billboard. And that's a deal, apparently. I didn't realize billboards were that expensive. Some of the most popular products at one of the North Mason stores, the Root Cellar, there's something called Dragon Balm. It's THC infused, oil. Have you heard of it? It's a lot of people use it. That's their most popular product. So for pain, that sort of thing. Most of the other stores were, smokable marijuana with high potency THC. The THC levels that if you tried it when you were younger, back in the 70s, it was less than 10%. 80s, less than 10%. It started like, these guys were able to make this stuff and grow this stuff with THC levels at 60, 70, 80, 90%. It's just way up there. We've had some youth overdoses lately, and we're not always sure exactly what they're using. They could be actually overdosing, or at least smoking high, or edibles, the other one, using high THC level and actually overdosing, passing out in school, that sort of thing. So until we get those toxicology reports, we don't always know exactly what the students are overdosing on. So very high THC is happening out there. Both stores reported they serve older people, a lot of veterans. That's kind of a big deal. A lot of people coming from Seattle, coming through Belfair, coming through Shelton. They're going to the Olympics, they're camping, they'll stop in. The prices go up and down with the seasons. They want, and they actually said, we want to get more money from the tourists when they come through. So, packaging is typically super bright. That's one of the things our coalition members, especially Brooke, who ended up taking some pictures, and I'll show you some pictures on here pretty soon, of some of the cannabis products. And then she took pictures of some like licorice and other candy products, put them next to each other, and it really shows how easily and possibly children can possibly get into the stuff if it's in the cabinets or on top of a counter. So we'll get to that pretty quickly right here. So this, I don't know if you want to comment on this, Brooke, but the one on the left is just the regular licorice, and the one on the right is, oh, go ahead.
Dilma, were you speaking?
Well, so it was my first experience, and sorry I've been very slow because I got so many papers to do today. But listen, everybody, yeah, it was a good experience, and I have a different idea about those retails before. I had the taboos, but I think they're doing a great business and kind of transparent for what we see, right?
The market.
They follow the rules, and I was concerned a little bit about those products they sell, like ice creams and people, like those snacks, like Cheerios or whatever, potato chips. Because if you bring those homes and the little kids, they don't know what is that. They will eat it. So that was the only concern I have for those retail places.
Yeah, so generally you're talking about, some of the stores actually sell like pints of ice cream. They almost look like a Ben and Jerry's size, Yeah, they're bright colors.
I even want one for myself.
Well, the packaging is similar to chewing tobacco industry went through when they started doing the flavoring chewing tobacco, and the packaging was grape and strawberry and.
Exactly, and that's the issue that our coalition members and coalition members across Washington State. There's people like myself in every county that have coalitions, and of course the larger counties have multiple So we've been working at a state level also to basically kind of fight the packaging issue. That's one of the issues, and the promotion issue. One of the issues is they wanted to be able to put signage out on the street. We're talking about signage with, the food industry. But the way I think about it is my gym will put these little $1, for membership, that, and they put like 10 of them, up and down the street. Well, the marijuana industry, cannabis industry wanted to be able to do the same thing. That failed this year, so we felt good about that. But there's a lot of other policies and laws that they're trying to push, so it's easier for them to promote and sell their products. But Dilma was talking about the ice cream, not popcorn, potato chip bags.
Yeah, that stuff I don't like in those places because the parents, I don't have a children anymore, I will no worries. I'd be a customer for them, but I worry about those young parents, that sometimes they don't thinking about the children having access. So that's why I like the idea of promote the security boxes we was trying to tell them.
So yeah, that's at the end of our presentation. So I'm gonna move on. Here's the next. So on the left, Lifesavers. On the right, it's called Boozies. The bright colors again. This is from one of our stores. I think maybe.
So let me get this straight. You bought a bunch of marijuana?
No, we didn't buy it. They let us take pictures.
Just kidding.
Yeah, and those Lifesaver, a lot of kids love those things. Oh my God, yes, you don't even, because they don't put really big, they say what it is, and even kids don't have it.
No, that's.
Don't have to read. They will still don't see that because they just see the beautiful candy over there, right?
I want to say something about that packaging, if you can put it back,
Sure.
Ben. To Vilma's point, on the doozies, you see in the lower right-hand corner that there's a sign that says it's marijuana, and there's also a hand that says not for kids. But it's very small.
Yeah, it's small.
And it's kind of buried in the busyness of the packaging. And one of the things they were saying in one of the cannabis stores was kids will be able to tell the difference in this packaging. And we know that there's been increased emergency room visits and poison center calls because of children getting a hold of edibles. And so I don't believe this packaging is very it's distinguished between regular candy packaging.
So, especially for those children who has development disability, are you kidding me? They don't know how to read that. They don't understand that. Yeah, so
most kids aren't good at it.
My children,
somebody
they would just be like candy and they'd start eating it and they'd be like, oh, what's wrong?
There's always that 5-year-old that can read. It's not for kids. They can read it.
So commercial, they put in a bottle, very small, and nobody can see those things really well, unless they're very personally educated person who read everything.
We don't have to worry about the kids.
They just put in a table and the kid will take it or whatever.
Yeah, and to be honest, they're following the rules of the state right now. I mean, but we don't know, we don't believe that it's, that's strong enough. We're talking, maybe somebody under 3 years old or 5 years old might not be able to read that, but, so how do we as public health and, encourage our officials to help push this issue? Because like Brooke said, poison control is reporting, overdoses, accidental overdoses, not just for children, but for pets too. Let's get into this stuff. Let's just move on. There's
You're
a
still
lot.
zoomed in really far, Ben, so you're missing part of your slide.
Oh, am I?
Yeah.
It's too zoomed in now.
There you
Okay. So this just basically talks about what we've already been talking about.
Yeah.
So even pipes, and the next slide will show you some of their other packaging or other ways that the other things they sell to actually hide some of their product. So this Pringles can was at one of the stores, I think it was in Belfair. And it has a Christmas theme. It has the Pringles kind of, that's what you would think it is. But it has a little secret compartment at the bottom that you can hide your.
They've been using those things for 34
Oh,
years.
yeah. But this one they're selling.
Pepsi cans and stuff.
Yeah, they're actually selling them at the stores. Here's the next one, which is kind of odd because this is like a Bud Light.
I don't even know what was those one. Remember I asked him?
Yeah, so these had hidden compartments underneath also.
I'm so naive in drugs. I'm the case manager for people in addiction, but I'm still naive in some drugs.
Well, it's not to hide it from the kids, it's to hide it from the other guy inside the room so he don't steal your stuff.
Or your roommate's pitching weed.
Yeah.
So, one of the things that we like to do in prevention is called environmental change. So policy changes. We just worked with the city last year to have no vaping in city parks. The county has done it a long time ago. That was part of what we did. No smoking in vehicles, no smoking in offices. That was part of a state law, but we actually implemented that before the state did, like right before a few months. It was King County, Pierce County, and Mason County. We were right up there. Right now, we are working with, we talked to every one of these, they all agreed to work with us in providing lock bags. So we're able to order some lock bags. You can lock your cannabis, vape products, oils, medication, that sort of thing. The store in Belfair has said that they will do a little pilot project. We came up with a little survey that will go in each bag, and it has information on, poison control, if they need more information on lock bags, that sort of thing. This is safe storage tips on this side. They did the survey. We're hoping to get a little information from the users because we're going to ask them to each store to put up a sign that looks like this. Tabletop sign, we'll have the bag in front of it. And most of the stores that we went to, all of them said they know their patrons. They know their family members, their neighbors, their regulars. So if they know that they have children, they're going to offer them a bag and ask them to use it and ask them to do the survey. Other counties have tried it. Surveys don't always work that well. What Pierce County is doing now, they went through a first round and they didn't get a lot of surveys back. So they're actually going to the store, sitting in the store, and asked if they've taken a bag. And if they had, then they asked a few questions. It's literally 3 or 4 questions. We didn't want to make it long. We just want some information. So if this works, we would like to be able to provide those bags in the future by putting in grants, that sort of thing. So we're starting out with 150. I just ordered another 150. So we should be able to do it at least at one store for a little while. Like I said, we're starting in Belfair, but we may move to a store in Shelton. And there's a law that says the stores can't actually buy the bags and sell them. They can buy them, but they'd have to give them away. So nobody's willing to do that. Right now, it doesn't seem sustainable that Mason County Public Health or Mason County would be providing bags for these stores forever and ever and ever. But we want to see how it goes, and if they're being used, we want somehow be able to continue that process.
So is that a federal regulation that they can't
It's a
give
state.
them up?
it's a state regulation.
Yeah, it
But
was
they can't
actually
sell
Mason
them.
County that helped get that pushed through where they were allowed to do them in the
Yep.
stores. They weren't even allowed to give them or sell them or anything in the stores. Mason County kids.
It was
from North
myself and Dan Griffey
Mason. Yeah,
that worked on that right after we started. I went to every store and we wanted to do bags or boxes. And they said, we can't give away anything. Back then, they couldn't even do free hot dogs at a grand opening. And so I came back to the office and somebody at the office said, hey, call your representative. Call the representative. And literally within the next 6 months, somehow we got a law change and everybody's saying, how'd you do that? That never happens. So,
I just wonder what the purpose of that law is that they can't.
they didn't want them selling other things other than marijuana at the time in there. They didn't want them selling other toys or anything. They weren't allowed to sell any of that stuff.
But they can't even give them away.
Well,
No,
all
they-
that's
they
been,
can't.
Yeah.
yeah, it's
Oh,
been
they
changed now
can't.
because of that law change. Amy, boy, that's a flash from the past. Ben, now you're coming up on about 25 minutes.
okay, so really quick, Brooke, do you have anything, or Dilma, really quickly, on this issue?
We're good, thank you.
I think that one of the things we're looking at is a long-term, or hopefully not too long-term, but doing things that make it normal and, obvious that people can be putting cannabis products away from kids. Just making it harder. Instead of just kind of putting it with other food or having edibles a little too available. So it's, this is a legal product, and what we're trying to do is work with the cannabis retail stores to help customers use the product more safely in their homes.
And you can finish it if you have more to do. I guess we have another group coming in.
Okay. The last thing is some of you probably got emails from me about the Mason County Prevention Summit on May 8th. It's an all-day summit at the Squaxin Island Tribal Kitchen. We'll be providing lunch that day. I went to the Tribal Council meeting. They're going to be providing a welcome, a prayer, some snacks for that day, and the space. We've been going back and forth from the Squaxin tribe. Last year we were at Skokomish, so we really appreciate their support on this. Our speakers are Dr. Jason Kilmer, who has provided information for us in the past. He does a great job. Representative Lauren Davis, who is going to be talking about cannabis and opioid use. She is a champion of fighting this kind of stuff and getting some of our laws passed at the state level. Samantha Galea, she is our Miss Washington, and she is a dentist. She's the first doctor to be a Miss Washington. Usually it's kind of a younger, although last year's was somebody who had been in the military. So, and then Sarah Ellsworth, who works for ESD 113. She's going to be talking about mental health promotion in school-age youth. Alex Saraski will be talking about vaping, current evidence and considerations of vaping. So you're welcome to be there. Last year was a great event. It will be streamed by Mason Web TV, and we have a lot of partners, the tribes, FES. Babe Gardner is going to be our MC for the day again. He did it last year. And I'd like to have you all attend if you possibly can. One other project that I'd like to mention is a social norms project. We're working with North Mason High School, Choice High School, and Shelton High School on doing a social norms. If you've ever been riding down a street and a car goes by you at 80 miles per hour and you go, oh geez, that crazy driver, and you're just kind of cruising along for an hour, and then another person goes flying by you, and these Washington drivers or Thurston County, wherever you're at, they're the craziest drivers ever. You go home and you're kind of complaining to your spouse or your family about all the crazy drivers. Well, the norm is that most of the drivers are probably going 60, 65, and you're going down the highway with thousands of drivers about the same speed, right? So the norm is most people are doing the right thing. Same thing with chemicals. Our youth aren't all doing drugs, okay? Our latest Healthy Youth Survey, about 15% are doing vape, in the last 30 days. 15% are drinking alcohol in the last 30 days. So that means, what, 85%, aren't? So that's the message that I like to put out. And so our youth are working on some like poster programs promoting a social norms project for us. So you might be seeing some of that in the future. I just want to let you know that that's happening. Other stuff too, listening sessions are happening, and that's been quite fun, having some of our community leaders talking to our student youth. Any questions or?
Any questions from the board?
Great presentation, thank you.
Thank you very much,
Thanks,
appreciate
Brooke
you.
and Dylan as well.
Yep, thank you, Brooke, thank you, Dylan.
Thank you. Have a good evening, everybody.
Okay, next up is our other business and board discussions. Commissioner Schutte had some things he'd like to discuss.
Yeah, so just looking at our calendar and our schedule for these meetings, I'm talking with staff here, thinking about looking at changing the time of our meetings from the 3 o'clock time frame to 11 on Tuesdays. And then one of the other suggestions was looking at moving to quarterly meetings as opposed to bi-monthly. And so just wanted to put that out for some board discussion and get some feedback. I think it would work better for all the other things that we have going on staff-wise and commission-wise at the county. So.
If we can, let's bisect it a little bit. 11 o'clock start time. I know for myself, it'd be a lot better because I try to go to Kitsap and then come back. But does anybody have any heartburn with that, starting at 11? Anybody on the Zoom land have a heartburn with starting at 11? Hearing none, you want to make a motion on that one?
Yeah, I'd move that we adopt 11 a.m. as our new Board of Health meeting times for the remainder of 2024.
Is there a second?
I'll second that.
It's been moved and seconded that we change our meeting times to 11 a.m. For the remainder of 2024. Any discussion? All in favor signify by saying aye.
Aye.
Aye, the motion carries. The next one up is the talk about going quarterly. You want to explain a little more about why quarterly you think we can get it all done?
Yeah, no, it was a conversation that I think has happened here in the past with staff and the board, and just want to see about board openness to meeting quarterly as opposed to bi-monthly. And
I don't know if Ian has that much to give to us in bi-monthly. I don't know how much we could have quarterly.
Ian admitted that he made a mistake today.
Well,
That was quite a lot.
and normally, that's up to us to how we do it. Normally, we would have a 15-minute presentation with a few minutes for questions afterwards, but we've never done that, so nobody knows until we say it for presentations on items. If we were
And
to,
if they're long, then the person has to buy lunch, because it's 11.
yeah, bring lunch with them. First of all, in the room first, does anybody have any comments on that or any other thoughts on that before I go to the board? We're not making a motion yet, we're just talking it out right now.
Yeah.
I know that Dave had a comment, so is there anybody else before Dave that has a comment on meeting quarterly? Hearing none, Dave, please, share with us.
Yeah, I guess I'm unclear as to the why we wanted to move to quarterly. And then I would tie that with, if we do move to quarterly, is the board willing to go to longer board meetings in order to accomplish some of these things?
So I would just say that we're already at almost an hour and a half for today's meeting, so it's not we work until the work is done, number one. And number two, by and large, most of it is information or discussion, and I think we took a couple of actions today to appoint members, and a lot of it is just sort of approval of agenda and minutes and things like that. We're not necessarily always creating or setting policy. So I don't know that for the types of updates that we're getting, we need to meet every other month. If you would like to have us do more policy work, and you'd like to bring more policy level discussions to the board versus program updates, I think that's maybe a different conversation, and maybe there is merit to meeting bi-monthly, but in the current format, I don't think that we're doing a ton of work that's, policy related.
There's also go ahead.
I was thinking about what you were just talking about, Dave's talking about. The other consideration is we could call a meeting if we had to call a meeting.
Right.
Yes, that's what.
Because the other part of
that's
that
what
is,
I'm-
you've also got to pay attention to staff needs. There may be some action that staff may need, and they go, we can't wait 3 months for a meeting. We need to have action on this sooner, and in that case, we could call a meeting based on that, right?
That's what I was thinking as well. It could be called the motion can be made where it could literally just be called by the director of the health department, not have to go through a whole other process, if that was the case, when needed. Other than that, the meetings go as long as they go, and we've always been good about that. Like you said, today we're at hour and a half, but quite often these meetings are not even going near that. So, other than that, I actually like the idea of allowing for the director to call for a meeting. Does that alleviate some of the?
Yeah, that helps. I think as we go forward, especially if we start branching out into new things, we're going to need some board input on, direction.
Well, and let's never forget, we went through a period of time where we had to meet all the time.
Yeah, we
That-
met monthly.
Yeah, that wasn't that long ago that all heck was breaking loose. So if it breaks loose again, we know what to do about it. But for now, if he was to make a motion before he makes it, does anybody have any serious heartburn with that? Then I think we're ready to entertain your motion.
I move to amend the meeting, schedule to Board of Health meeting monthly and as needed.
Quarterly, yes?
My bad, oh my god.
What happened? I missed it.
It used to be monthly, quarterly.
Quarterly, yes, sorry, I moved, I withdraw that.
Quarterly or
motion.
as needed, called by the director?
As called by the director, yeah.
So do I have a second?
Second.
There's a motion on the floor to adjust our meetings to quarterly unless called by a special meeting by the director. Any further discussion? All in favor signify by saying aye. Aye. Any opposed? The motion carries. Is there any other business or board
So when's
discussion?
our next meeting?
If I may,
Because we've done that, now you have, as a board, set the dates for the remainder of the year.
Yeah.
Yeah, and we'll be waiting for you to do that at our next meeting at the quarterly.
July would be the next one.
July
Okay, so our next meeting right now, Ian was saying to be July
at 11 a.m.
at 11 a.m. Okay, any other board discussion or?
Oh, no, be June. April, May, June. Yeah, sorry, I'm wrong.
June?
June,
So-
yeah.
But we should probably leave the professional up here to schedule
Yeah.
and send them out.
I think he's right, it'd be June if
That'd
we're
be
doing it quarterly. So, Mackenzie will let you know.
Okay.
Okay, any further board discussion or comments? Hearing none, any public out here that would like to comment? Any public on Zoom that would like to comment? I see you have unmuted. Art,
go ahead. Yes. Thank you very much. Good afternoon. My name is Art Whitson, and I live at 1591 East Mason Lake Drive East, Grapeview, Washington 98546. The last 3 years that I've lived on Mason Lake, I have witnessed algae blooms, some of them potentially toxic. I represent the Mason-Benson Lake community, and I'm a Port of Grapeview commissioner. Also, I'm a member of the Mason County Clean Water District Advisory Committee. My education and professional background has been in estuary ecology, civil engineering, and systems and reliability engineering. I'm a professional civil engineer registered in Washington State. So back in winter and fall of 2023, and then recently winter of 2024, we had several balloons that were very interesting. When I saw pictures of them, they were sent around via our Mason-Benson Club website. I recognized that it was probably blue-green algae, a common name for a variety of cyanobacteria species that are potentially toxic when concentrated. I spoke to, first I spoke to Ian because I knew his name, and I've worked with him on the advisory committee. the health department can basically go out and take samples, but they have no real capacity to do the analysis. They send all their samples to, I believe, the Washington Department of Ecology Laboratory in Manchester, where they do have that capacity. And in fact, they have a team that does the sampling and takes it to the lab and does the analysis. But unfortunately, that team is only works basically from April to October. And these blooms occurred basically late fall, early winter timeframes. And so it's kind of a catch-22 if there's an issue when those teams aren't around. Being a port commissioner where water quality is an important attribute and concern within the port waters of its jurisdiction, I found a water quality lab for the winter of 2023 for that bloom, and had a microbiologist that could confirm the bloom to be cyanobacteria. How toxic the bloom was not confirmed, however. By the way, the key ingredients for an algae bloom are warm water, sunlight, and the availability of nutrients. And fresh water that is typically phosphorus. The presence of phosphorus in a water column above background typically is an indication of a failing septic system or landscaping fertilizer and or both. There were two other algae blooms that occurred on Benson and then Trails End lakes in April 2023. The Department of Ecology lab apparently was open. Mason County was very quick to respond. I was impressed. And they had the signs up, at least on Benson Lake, saying, no fishing, water activity, that type of thing. Fortunately, those blooms were determined to be non-toxic. So, what can we do about it? As indicated earlier, government labs such as the Washington Department of Ecology Lab are not available during late fall, winter, and early spring months for algae bloom analysis. Mason County Health Department has the capacity to take the water samples year-round, but do not have the microbiology algae lab identification capacity. So what I'm recommending is that we convince Washington Department of Ecology to have this team that basically does the samples and does the analysis on algae blooms to be open year-round. Or fund a county health lab that has the capacity to ID cyanobacteria when the Washington Department of Ecology is not available, or hire an external lab contractor, which I did. It seemed fairly easy. It was kind of expensive. It was about $125 per sample, and I don't know what the requirements would be as far as what the sampling routine were and how many samples you take when you try to verify an algae bloom. But anyhow, so to summarize, some Mason County lakes are having very unusual algae blooms during the winter months, some of which are potentially toxic. Mason County Department needs to have the capacity to analyze algae samples during the months when Washington Department of Ecology is not available to do the analysis. Either convince Department of Ecology to have that capacity year-round, or fund an internal or external lab with that analysis capacity. So thank you very much for listening to my concerns.
Thank you, Art. Is there anybody else who would like to speak to the Board of Health at this time from the public? Seeing none, I will entertain a motion.
Move we adjourn.
Second.
It's been moved and seconded. We adjourn. Hearing no objection, we are adjourned. Thank you, everybody. Stay long enough to sign the minutes, and it's already been corrected.